last night, President Obama gave one hell of a speech. Notice the long pause. It was one hell of a speech. I am looking at the stock. I'm here on the New York Times stock page, and I'm looking at United Health Group's stock. It is up for the day quite substantially. Let's see. They started trading at $28.20, and it's up to $28.60 now. The United Health Group, the insurance company, is up 8.94% for the 30-day period. WellPoint is up 5.39% for the 30-day period. Aetna is up 8.05% for the 30-day period. It seems that Wall Street, and these guys are no dummies, and they've got their money on the line. It seems that Wall Street doesn't think that the health insurance industry, the death care industry, has much to worry about. Looks to me like it looks to them like everything's just fine. And I think from their point of view, everything is just fine, and I'll share with you exactly why as we continue. On healthcare, I have some concerns. You have as the corporate media in America characterizes folks like you and me, you have the loony left saying we would like a public option. And then you have, as the corporate media characterizes the corporate right, the mainstream, I'm sorry, ain't, but, nonetheless, saying that they want the for-profit companies to be able to keep making a profit on health insurance, and they call it health insurance. Frankly, it's not insurance. I'm going to get into that rant in just a moment, and it's a really important one. But this whole public option thing, I am quite certain. I mean, if you look at the legislation so far, it's right there. Now, who knows what's going to come out of conference? And maybe the president is saying to the Blue Dogs, don't worry, we'll give them a phony baloney public option. And then at the very last minute, he's going to pull a bait and switch, and in conference committee, he's going to demand a real public option. If so, he will have earned my undying gratitude and loyalty. But I don't expect that's what's going to happen. I think that we're seeing DLC rather than progressive politics be played out here, because the legislation as it's written right now, only 5 or 10% of us will be able to buy the public option. The only way you can buy the public option is if you happen to have a job so that you have enough money to buy it, and your employer does not offer any kind of health care whatsoever. Because if your employer offers health care, no matter how health insurance, for-profit corporate health insurance, even if it's health insurance that is provided by the employer themselves and administered by one of the big companies, so the employer themselves is making a profit on it. If your employer is offering insurance and you turn it down, you cannot buy into the public option. Therefore, it's not a public option. And this was the president last night essentially making that point, although he was making it in code, but it was in code to the Blue Dogs. Here he is.
An additional step we can take to keep insurance companies honest is by making a not-for-profit public option available in the insurance exchange.
That sounds nice, but let's tamp it down a little here. We got the progressive.
Let me be clear. It would only be an option for those who don't have insurance.
Right.
No one would be forced to choose it.
Or can choose it.
It would not impact those of you who already have insurance.
Because you're stuck with it.
In fact, based on Congressional Budget Office estimates, we believe that less than 5% of Americans would sign up.
Actually, 5% of Americans could sign up. So, it's, as I said, I think it was a great speech. He is a great speech maker. I am very, very concerned about this policy. I mean, here's, some of the parts. I mean, this is.
Now is the season for action. Now is when we must bring the best ideas of both parties together and show the American people that we can still do what we were sent here to do. Now is the time to deliver on health care.
Yeah, now's the time to deliver on health care. But what we have in the United States is not a healthcare system, and nobody is talking about healthcare systems. We're talking about a health insurance system. See, insurance is where you are, you're basically betting against the insurance company that something's not going to happen. You buy car insurance, you're betting you're not going to have a car accident. If you insure the possessions of your apartment or your home, fire insurance, theft insurance, odds are you're never, ever going to use that. Most people never, ever use those things. We're all eventually going to need health care. We're all eventually going to, God willing, be old enough to have health problems. And this is where the health insurance companies, this is the bet that they're making. The bet that they're making is that by the time you really need health care, you're 65 and you're eligible for Medicare, and they can toss it off on the government. And that's why the health insurance industry in the United States is not even offering insurance. Real insurance actually pays out when you need it. If your house burns down, they pay for your house. If your car gets wrecked, they pay for your car. They don't complain. They don't fight. We don't even have a health insurance industry. We have organized crime.